Hi, my name is Dr. Mohiba Tareen and I'm a board certified dermatologist. I practice in Roseville, Minnesota. This is my colleague Jen. Jen is in her early 30s, go ahead and lift, and has a little bit of under eye circles. So if we look, she's a beautiful young lady, but under her eyes she's missing some volume, which happens as we age. What happens is that these fat pads that used to be under the eye descend. So what I'm going to be doing today is putting a little bit of a substance called filler, in particular something called Restylane Silk, which is a very silky, smooth molecule, here under Jen's eyes, and it's just going to lift that up almost immediately. So this is what the filler looks like. It's this clear substance, just a very soft gel. I'll be placing that and we will see that difference immediately. So my colleague Erin is going to clean the areas first. We typically use a little bit of light numbing cream for about 20 to 30 minutes beforehand, but Jen's a super trooper and didn't do any numbing cream. So this is an ice roller, and that helps to make the small injections very comfortable. So Jen, what are you hoping to achieve with this?
Just a little more volume.
Absolutely.
I feel like I look tired all the time.
You definitely do not look tired all the time, but as we age, we do lose a little bit of that natural volume. We don't necessarily lose the volume, it just goes downwards with gravity. So by placing this filler deep into the skin, it lifts it very naturally. My colleague Erin, who is beautiful, has a little bit of filler under her eyes too, just the smallest little amounts, just in the middle, just kind of help bring everything up. So I'm going to begin. Jen, I'm going to have you tilt your head down a little bit. Again, this is that little light Restylane Silk. Jen, you're going to look up with your eyes. Perfect. What that does, that helps get the orbital rim out of the way. And then on the count of 3, 1, 2, 3. Pinch. You okay, Jen?
Mm-hmm.
So what I want you to focus on is that right away, if you can appreciate that lifting of the skin, it's immediate and it's very satisfying. Good. How was that in terms of discomfort, Jen?
Oh, great. None at all.
Awesome. Keep looking up for me, Jen. Look at how good it's looking, Erin. Again. 1, 2, 3. Pinch. Are you okay, Jen?
Mm-hmm.
Perfect. You can close your eyes. I'll have you hold this, Erin. So, if we look, we can see that middle area is already lifted. We can see that little bit of depression there where I have not yet put that filler. So that middle is lifted. Now I'm going to go out here to lift that area. Thank you, Erin. So Erin's going to ice again. I'll have you lift your eyes again, Jen. Perfect. On the count of 3, Jen. 1, 2, 3, pinch. You okay?
Mm-hmm.
So you can see the depth of these injections. I'm really going underneath those blood vessels to really softly lift everything from just a deep, natural volumization. Ready, Jen?
Mm-hmm.
1, 2, 3, pinch. Good job. And the satisfaction is immediate. Look at how good it's looking. Now, for these little fine-tuning touches, I'll have Jen close her eyes. Jen, I'm going to just go a little medially. Ready, Jen?
Mm-hmm.
Pinch. How are we in terms of discomfort, Jen?
Barely any at all.
Awesome. Ready, Jen?
Mm-hmm.
Pinch. Pinch. Good job. Hold, Erin. Beautiful. So what I'm doing now is just molding and massaging the very soft filler along the orbital bone to make sure that it looks natural. Perfect. Close your eyes for me. Now we're going to go to a sensitive area, right that middle corner of the eye. In a lot of us, even in very young people such as Erin, we can see a little bit of volume loss there. So this is going to help with that little bit of shadowing. So I'm going to go right there, Jen, okay?
Mm-hmm.
Ready, Jen?
Mm-hmm.
Pinch. Oh my God, how perfect is that?
Amazing.
Beautiful. Perfect. So now, if the audience can focus on, go ahead and lift for me. You can see definitely some redness. You can see this darkness in the skin almost looks kind of not as healthy there, just because from the volume loss, the shadows will reflect against that deeper volume and make it look dark. When we look at Jen on this left side that's treated, sorry, I have to orient myself, you can see that the skin just looks brighter there. So we have a nice little brightening. Wait till you see, Jen. Can I have your mirror, please? Great work.
Oh, yes.
Do you like that difference?
Yes, I do.
Awesome. So I'm really happy with it. What I would suggest really fine tuning, if we look right here, let's look, Jen, you take a look too. I want a little bit more just there.
Yep.
You can see a little bit of a hollowing there. So this is just a little perfecting touch. Good. Ready, Jen?
Mm-hmm.
Pinch. You okay?
Mm-hmm.
Perfect. So that is nicely lifted now. I'm gonna just do a little bit along Jen's cheekbone just to lift there. Ready, Jen?
Mm-hmm.
Pinch. Pinch. And pinch. Hold for me, Erin. And what that does, that brings the face upwards too. So you can see this nice little bit of sculpting of the face compared to, I mean, she's a beautiful young lady, but it just kind of brings everything upward. So that entire left side is done. We'll get it before and after, and then we'll do the right side. Perfect. So we've done the left side of my colleague Jen's face. We did under her eyes, and then we just did a little bit in the cheeks. So we've only used half a syringe of the filler thus far. It's so important in a young person to not do too much, just a little bit to kind of enhance and lift, but definitely not to make the individual look artificial. So now I'm gonna do the right side. We'll begin under those eyes, and then we'll do a little bit along the cheekbones. So again, my colleague Erin is cleaning the area. You can see just a little bit of cleansing. And she's going to use that ice roller to help dissipate some of the bruising and help with the discomfort. Awesome, so I'm just gonna stabilize Jen's face. You put your chin down, and we're gonna have you look up with your eyes, Jen. Perfect. On the count of 3, 1, 2, 3, pinch. You okay, Jen?
Mm-hmm.
Good. So we can see right away that little bit of filler put into the tear trough area, and that lifts it. Good, I'll have you come on this side. You look up with your eyes, Jen. Pinch. You okay, Jen?
Mm-hmm.
Beautiful. Oh, it's looking so good. Good, look up again. Pinch, Jen. Good job. Amazing. Beautiful. Close your eyes for this part, Jen. We're gonna go just into those little corners now. Pinch. You okay, Jen?
Mm-hmm.
Beautiful. Pinch right there, Jen. You okay?
Mm-hmm.
My God, wait till you see this. Gotta open your eyes for me. So I want the camera to just see that the discoloration is almost gone. You saw before how kind of brown the area looked, but because of filling that, now the shadows reflect against the more normal skin without having that discoloration. Good. Here, this, close your eyes, Jen. Pinch. Again, we're just going very deeply to volumize the area. It's beautiful, absolutely beautiful. Now here are my little secret drops along the cheekbone just to give some more definition to that cheek, and it's gonna make the eye area look better, you'll see. Ready, Jen?
Mm-hmm.
Pinch. 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 Awesome. Good, go ahead and look straight at me. Great. Now we're gonna do just last drop, Jen, ready?
Mm-hmm.
Pinch. Perfect. So you can see both sides are very symmetric and lifted. That discoloration, the depth of those hollows under the eyes are gone. And this is achieved with just 1 syringe of filler. Thank you.